Guide to help you make the right decisions. COVID-19. Decide how much distance to keep. The concepts of social distancing and self-quarantine are interpreted in different ways, not always correctly. Social distance: to stop the coronavirus we must act quickly and start making daily decisions to keep as far away from each other as possible, but how to make those decisions has not always been clear. Concepts such as social distancing, self-quarantine, and isolation come from the lexicon of the infectious disease community. Here in real life, parents, workers, and even government leaders are fighting to make sense of it all. To help you make good decisions, based on the advice of experts in infectious diseases and public health, we will try to explain it to the best of our ability. Social distancing. Social distancing is creating a physical distance between people who do not live together. At the community level, it means closing schools and workplaces and canceling events like concerts and Broadway shows. For people, it means keeping a distance of 6 feet between you and others in public and avoiding physical contact with people who do not share your home. But one aspect of social distancing, the warning to avoid meeting people, has created a lot of confusion. At this time, everyone should limit close contact, indoors and outdoors, to family members only. This means that there are no dinners, game dates, birthday parties with some friends. Shelter in place. Simply put, this means #staying home. Do not leave home unless absolutely necessary. Don't socialize with people outside your family. Do not go to dinner at a friend's house or invite a trusted friend. During an on-site shelter request, you are generally allowed to go outside to shop for essential items, pick up groceries, or recipes, but you should limit those trips to no more than once a week if possible. People with essential jobs, public safety, medical, health or grocery services can still go to work. And you can visit someone if you are their caregiver. In most cases, a shelter-in-place order allows you to walk the dog or exercise outdoors for short periods, as long as you keep a distance from others. Recommend and people who ask that outdoor activities that are solitary or that take place in parallel with someone who is far away be fine. We are trying to avoid face-to-face contact, especially in closed and closed spaces. Who should do this? Everyone who lives in an area with a mandatory shelter-in-place order. But many infectious disease experts say everyone else should also voluntarily shelter in place to prevent the virus from spreading. Self-control. This means checking your temperature regularly and looking for signs of coronavirus infection, such as fever, shortness of breath, and cough. A person who controls himself should already stay home and limit interactions with others. Who should do this? Self-monitoring is for people who find out that they may have been exposed to the virus but only had distant contact with the infected person. Self-quarantine. This term is used to separate and restrict the movement of someone who is well but who recently had close contact with a person who later was diagnosed with the virus. A person in self-quarantine should follow all the rules of sheltering in place, except they should avoid going to stores or interacting with the public even on a limited basis for a 14-day period. A friend should bring you groceries. Quarantine means staying home and away from other people, including those in your household, as much as possible, for a 14-day quarantine period. A person in self-quarantine should sleep in a separate space from family members. Who should do this? Anyone who does not have symptoms, but who had close contact with someone who later became ill. Self-isolation. Isolation is used to separate a person who has a diagnosed case or someone who has distinct symptoms including a cough, fever, and shortness of breath, but hasn't yet been tested or received test results. A person in isolation should be confined to a separate room with no or minimal contact with the rest of the household, including pets, and use a separate bathroom if possible. Most of the time, a sick person will feel a bit miserable, but he or she can pick up food trays left at the door and sanitize a shared bathroom after using it. Who should do this? Anyone with a confirmed case of COVID-19, in consultation with their doctor, a person waiting for test results, or a person with obvious symptoms who are still waiting to be tested. Everyone else in the household should self-quarantine. Official or mandatory quarantine. A government-imposed lockdown on a community, people can still go out for essentials and to get fresh air, but they can do so only under strictly controlled conditions or on a specific schedule imposed by public safety officials. Who should do this? Everyone who lives in an area under quarantine.